Hi everybody, today we're doing a special video discussing therapeutic use of animals. My name is Leilani Cruz and let's begin. Therapeutic use of animals is pretty much, which we know it's called pet therapy or animal assisted therapy as the book states. It's pretty much the animal helps the patient or the person cope with mental illness or any disorder they are battling with. For example, individuals that are blind, they have animals to help them guide them through specific areas that since they can't able to see. So pet therapy has taken a huge leap nowadays, and I myself have a service animal. Well, he's an emotional support dog. Service animals usually are for individuals, like I said, that who are suffering from disability other than, what I have, which I'll discuss later. PTSD, the veterans that are in service, they go around with their dogs, they help them cope with the trauma that they went through or they're still going through. The blind, certain groups like that, these animals have helped tremendously to help them cope with their disability. I wanted to go over certain aspects that the book discuss about facilitation techniques when TR are approaching with pet therapy. There are differences, like I said. I always get them mixed up, but there's oh, that's my grandfather. But I'll introduce you to him in a moment. There is a difference, like for example, Simba, he is an emotional support dog. So there's emotional support dog, service dogs, resident animals, what else? The book states, let me look at my notes here. Companion animals. So companion animals are often referred to in the literature, the conjunction with words of, a pet, a household pet. So like, it's your buddy. If you have a dog, that's your companion. So that's pretty much what the definition of companion animals are. Simba is an emotional support dog, so those who are suffering from a mental illness and severe anxiety tend to have emotional support dogs. Another thing that it's very important when it comes to techniques when approaching animals, recreational therapists should know that the use of these animals are to help the patient reach their emotional and physical health goals. So, if the patient is battling with depression, it's very important that the recreational therapist, the TR, helps them not only themselves but through the animal as well cope and able to improve on how they feel and how they're coping. Another thing that's important, contact with animals, it's pretty much consists of, this is a simple definition of like people who suffer dementia and Alzheimer's disease. They also have contact with therapeutic animals, such as dogs. I did an internship in the Palace this summer, and they had a dog named Prada that will come every week. The residents will pet her, have a couple of moments with her, and they will just reminisce on how, like, oh, I had a pet once. Like, for example, my grandfather, has Alzheimer's disease, and he when he doesn't, of course his memory has gotten affected due to the disease, and having Simba around makes him reminisce on the old times that he was in the farm and his dad, got him a dog, and it made him feel more at ease and at home with himself, having, the dog with him and petting him occasionally. So it does contact with animals. It's very important in general with not only residents but any person that is coping with a disability. Animals used with psychotherapy, that's very important as well, because that's the icebreaker between the TR and the patient. It's pretty much giving trust to the patient and to the therapist. It's an icebreaker, meaning that, you know, it's a little bit scary going to therapy sessions, and it's a little bit, you know, a little bit nerve-wracking, and they may bring a dog, a puppy in to soften things and makes things feel more comfortable, well, for the patient. And it just pretty much, it gives an olive branch of trust of, hey, I'm here to help you, let's have this session, my buddy here is gonna be with us, pet him, let him sit on your lap, things like that. Is pretty much what animal use in psychotherapy. Pretty much programs considerations before conducting this activity is anybody that suffers from allergies, asthma, probably they are allergic to dogs, to cats. So you might want to ask them, are you allergic to any animals? And if they are, that'll pretty much be the deal breaker. So get to know your patient as well before conducting this technique, this approach, conducting a therapeutic session between your patient and the animal. Materials, pretty much, you know, a squeaky toy, water for the pet, to make the animal feel better. And Juan, un momento, espérate un momentico. Yeah, I was telling him in a moment, we'll be introducing him and my dog Simba, our dog Simba. And it's just, you know, it's been quite a journey. You know, to give you guys a brief history, as I mentioned earlier, Simba came into my life because I suffer from extreme anxiety disorder. I would get chest pains frequently, in and out of emergencies due to pains, panic attacks, which gives you short of breath, and I'm asthmatic as well, so it would affect my breathing and it'll accelerate my heart rate. So I was visiting the emergency room quite often, and I fell into a depression hole. I wasn't doing good, not only physically but mentally as well. My mental state wasn't as, you know, I didn't want to leave the house. I was always just, you know, not feeling well. And I went to the doctor and he's like, how about we do a different approach? Let's give you an emotional support dog. Do you know what that is? And I didn't really understood. I was like, oh, it's just a pet. You know, it's a dog. I didn't have a dog back then. So I didn't know really how life-changing animals could be till like now. And as soon as they introduced me to Simba, it was a click. You know, he helps me cope. He helps me drop my heart rate in a steady pace. He helps me cope with my anxiety, and he gives me a mood booster, improving my depression. And I've seen such an improvement in my health, and my doctors as well, they've told me, you know, you have made a tremendous improvement due to the fact that you have Simba in your life. And my grandfather too, he has had a tremendous not only emotional but physical impact with Simba, because it's not easy. Alzheimer's disease, it's a very hard disease. It's not easy for not only for the patient but for the family as well. And his long-term memory was good, but his short-term memory was getting affected, and he, you know, slowly it was affecting his mood. He was getting a little bit more aggressive, and he wasn't really, just not, you know, things were declining. And as soon as Simba came along as well, not only things were helping, you know, he was changing my life, he was changing his. And you know, I know that people who, maybe somebody who's watching this has a specific disability or a disorder, and they have a service dog, and they can tell you that it is an emotional impacting difference, and he's made a tremendous difference in my life. And I can't, you know, imagine, you know, like my life differently without him in it. Another thing that I want to mention, fun fact with service dogs, you could bring them everywhere with you. And emotional support dog as well, because you could take them with you on airplanes when you have a traveling. Disney's becoming dog friendly. For those who don't know, that you could bring your dogs to the parks, anywhere. I take Simba to school, so they're very very friendly when it comes to animals. And also, if you're staying in a hotel, it's free of charge. They do not charge you if you have a service animal or an emotional support dog. As long as you bring medical papers, or your doctor stating that medically you need this dog with you, they will give you free of charge. So those are a couple of fun facts that, you know, if you don't know if you have an emotional support dog or your patient may have one, maybe you could tell them, hey, did you know you could bring them everywhere with you? And also, if you bring medical documentation, you could even as far as get free charge in a hotel if you're staying, especially now since the holidays are coming. Another thing, fun facts, is Simba, he is 4 years old, so he's a small dog. Before I show you him, he's very playful. He's been feeling bad these last couple of days, but today he's a little bit better. And thank you once again for watching this video. Before I perform the activity and I discuss it with you, another thing that I want to brush off that I read upon the book, this book is really good. It gives you a great description of what therapeutic facilitation techniques with these furry friends that we have. The care for the animal, the materials we went through. It's important for TR specialists to prepare carefully for a session involving therapeutic use of animals, since, you know, you have to handle them. You know, our furry friends tend to be very hyper, so it's very important to have some animal background knowledge before conducting your session or an activity with your patient. So this activity that I'm going to be performing with Simba, he loves his little ball, and yeah, so before I conduct, let's get to it. Pretty much, let me introduce you to my grandfather. Hey Juan, ¿cómo está? Hey Simba, come here. Yeah, he gets on the couch. He's very friendly with, you know, with residents and with people. Yeah, juega con el perro. Juega con él. Y si... Sí, mira a ver si se salta en tu... Si sal... Sí. ¿Te gusta Simba? Oh, man. Let me put him on top of him so he could... Oh, he, you know, he's pretty much an active dog. He loves hopping around. As you can see, he's very active. Let me show you his harness. As I stated earlier, having a harness is very important. It lets not only the person that's with you, or if you're at a airport or wherever you are, it's always important to have these harnesses on. Of course, I'm at home, so he does not have his harness on. So pretty much this is his harness. Hey. So it says emotional support dog. Come here. Come here. So pretty much this lets people be aware of, you know, hey, this person has a mental illness. You know, medically he or she needs a service dog to help them cope with the situation, and you know, it's very important to keep these vests on. Some say don't touch, don't pet. That's very important. Please respect service dogs, animals, or emotional support animals. Some of them, like I said, they don't like, you know, getting pet. They're with their owner. They know pretty much, you know, the only person is their owner. so they might not be friendly at first. Yeah. So as you can see, this is his harness. He travels with me with this harness on, or with my grandfather. Thank you for watching. Again, it's very important to be well aware of how important therapeutic use of animals have changed not only the patient's life but families as well. Speaking from a person who has a disorder, it's impacted my life positively, and these animals are medicine to the heart, body, and soul. And with that said, thank you, and I hope you guys enjoyed this video, and I enjoy the rest of your day. Say bye, Juan. Bye. Say bye aquí en la cámara. Say bye.
Bye.
Alrighty.
Bye.
Thank you. Bye.